Is your child or clients picky eaters? Maybe they have a diagnosis or need a diagnosis of a pediatric feeding disorder or ARFID, which is a different kind of feeding and eating disorder that we talk about today with our guest, Cuyler Romeo, who is an occupational therapist and a feeding specialist. So we talk all about the differences between just a little picky eating and pediatric feeding disorders and ARFID. And we have great free resources to help you get started on the path of trying to help your child or clients do better with feeding and eating. Let's get to this really great episode with Cuyler Romeo. Hi, Cuyler. It is so nice to meet you, and I'm excited for this episode.
Hi, nice to be here. Thank you for having me.
Yeah. So, I we are gonna cover pediatric feeding disorders and ARFID and how it relates to autism, signs of autism. It's a big topic, but before we jump in there, can you just tell our listeners just like a minute bio of, you know, what you do and a little
Sure.
bit about Feeding Matters, which you are here to talk about the great work that feedingmatters.org is doing.
Oh, absolutely. I'll first give you a little background on Feeding Matters. Feeding Matters is a system change organization. We are a 501c3 nonprofit with an international reach. We are the first organization in the world to unite professionals with families as well as community partners in order to change the system of care for kids that are struggling to eat. And we do that through actions in education, advocacy, like what we're doing here today, research, and most importantly, through family support. So a little bit about me. I kind of wear two different little hats. I am a clinician by trade. I'm an occupational therapist, and I have specialized in feeding, eating, and swallowing. I currently work in a level 4 NICU, but I've worked with children that are really working diligently to build their feeding skills in all different areas of treatment, early intervention and home health and outpatient clinics. So I've been really lucky to work with a wide variety of families. And then for Feeding Matters, I'm their director of strategic initiatives. So I get to work on initiatives that are important under any of those four pillars that will help move the system of change forward.
Okay, great. So my listeners that know me know that I'm a registered nurse and a behavior analyst, and I've done a lot of work with picky eaters, first with my own son, who was an extremely picky eater and had failure to thrive, and then with hundreds of kids. And we've done a previous podcast or two with Dr. Keith Williams, for instance, from the Hershey Feeding Clinic. We can put that in the show notes. That is a great episode, and he really takes a behavioral approach, and he's worldwide international behavior analyst, doctoral level, who runs that. Um, so from our brief discussion before we hit record, it sounds like a lot of picky eaters that have autism or go on to get a diagnosis of autism do have those that need to seek additional help, not just like, oh, my child eats, too much of this or likes to this, but extremely picky eater, like my son, who also then had failure to thrive because he got so
Mhm.
rigid with his food intake. Um, it sounds like a lot of the kids I've worked with personally and that we reach through the podcast and through my books and courses would qualify for a pediatric feeding disorder. So can you tell our listeners what is a pediatric feeding disorder
Sure.
and uh, what is it before we get into the ARFID, which is something a little bit different?
Absolutely. Um, Pediatric feeding disorder is a complex condition and it goes beyond what we would consider developmentally appropriate picky eating, right? As children are moving from infancy into toddlerhood and they're developing their autonomy skills, they begin to have an opinion, their growth velocity slows, they don't have as much hunger generation. And it's not uncommon for us to see some picky eating, but that picky eating should dissipate over time as they move through the developmental continuum. But for some kids, that picky eating is severely impacting their ability to participate in a mealtime and to gain the nutrition that they need in order to grow and thrive. And that's when you're moving from differences in eating to disorders in eating. And so a pediatric feeding disorder specifically is when that child is unable to take in adequate oral nutrition that's age appropriate, meaning that they can eat in a manner that you would expect for their age. Like a 5-year-old, they can use a spoon and a fork and drink from a cup versus still needing to be on a bottle. But they're not able to take in the nutrition they need for growth and development in an age appropriate way. And it's associated with dysfunction in one of any 4 areas. And that's where it gets a little bit more complex, because we can have dysfunction in the medical domain, we can have it in the nutrition domain, in feeding skill domain, which is my domain, or in psychosocial domain. You can have dysfunction in any of those 4 domains that can then result in a pediatric feeding disorder.
Right.
Mm-hmm.
And, I have examples where, I worked with a 2-year-old, and when I got there, he had just gotten a diagnosis of autism, and he only drank almond milk out of a bottle and only would eat French fries if you drove through McDonald's, if they were hot, if they were in the right container, and then he would eat gluten-free crackers.
Mm-hmm.
But then it got to and this is morning, noon, and night. That's it. That's all he ate. And, then it got to the point where if the crackers got broken, then he didn't want them. So you could see how, I heard of a child who would only eat doubled stuffed Oreos and
Mm-hmm.
pretzel rods, very extreme, and autism, and maybe gut problems, maybe,
Right.
celiac, maybe allergies, maybe other things, maybe swallowing problems or packing with,
Mm-hmm.
breads and foods and not really chewing and swallowing. And then also failure to move from smooth stuff to chunky stuff or finger foods, or even just looking at foods and being like, neutral colored crunchy foods are all I'll eat,
Mm-hmm.
I have so many different examples of kids, but those kids really do need not just a little tips and tricks. They do need an evaluation, wouldn't you say?
Yes, I mean, you really just created a lovely laundry list of signs and symptoms that we've moved from picky eating into extreme picky eating that could be disordered. And you also brought up an excellent point about the co-occurrence of functional gut issues or functional GI complications or medical complications such as celiac. So really, like, that first step is ruling out medical domain. We need to make sure that they don't have an issue with swallowing or aspiration risk, that they don't have underlying food allergies that haven't been treated, or constipation that's creating motility issues in their intestines. Because if you don't feel well, you certainly then don't have the energy and the stamina and the readiness to work on the next skill, which is really difficult, which is all of the managing all the sensory aspects of food. While you, as a person that may look at things differently, interpret food differently than you or I. Because for me, I can eat a different brand, or someone can cut my sandwich differently, and I recognize that still as an edible food. But for other people that have a particular way of looking and interpreting their world and environment, that's a totally new food for them. If you change brands, that legitimately, it does taste differently.
Mhm.
It is a new food, and that requires a whole new learning pathway for them. So I think really the first step is if you are struggling to that degree, is we need to make sure that families understand they're not alone and that they should not be facing these issues by themselves.
Mhm.
That we as a community lean in and get them access to the right providers to help them to build their team.
And we are going to, in the show notes here, we're going to link a free questionnaire from Feeding Matters. It's questionnaire.feedingmatters.org, and we're going to link that in the show notes. And that might be a good place to start. I often tell families, search feeding programs. Usually pediatric teaching hospitals would be a good place to start for looking. And then your city, state, country, you can do some work online, but if it's severe or if there's swallowing or if there's, those sorts of things, you might need to find, in-person help. And yeah, so I think that's a good overview of pediatric feeding disorders. And you had told me it's not a DSM-5 disorder because DSM-5 is psychiatric
Mm-hmm.
manual, and this is more of a medical diagnosis with medical codes with insurance covering, especially if you go to a teaching hospital.
Yes, it's a multi-domain condition, and we can have dysfunction in any of those domains. I like what you said though about needing to have a tool to help with that conversation. We hear from families all the time that it's really difficult to have those initial conversations with their pediatricians because we know pediatricians have very limited time. They have productivity standards. They have they have narrow gaps or windows to see their clients, and it can be difficult to bring up something like feeding without the language on board as a parent to kind of elevate your concern, so it's taken seriously by your medical community, and that's where that screening tool really comes in. The online questionnaire that we have that's called the Infant and Child Feeding Questionnaire serves as an education and advocacy tool because it's a smart tool and you work through it. It ages just for your child. It's for children that are on, the younger age of the continuum, but it allows you to work through and it identifies red flags. And then you can email it directly to your pediatrician so that you can have a more thoughtful conversation about next steps of what you would like to do next to get help.
Yeah, and even if you have an older child who has autism,
Yes.
doing that questionnaire, even though it's made for younger children, is fine because I have a digital assessment called the Barbera Early Childhood Assessment. It's
Mhm.
also free. You can take it at marybarbera.com/assessment. I'll link it in the show notes here as well. And part of it is feeding and
Mhm.
using utensils and picky eating, and if they're using a pacifier or a bottle and not, moving to age appropriate, foods and textures and that sort of thing. That's part of it, but there's also a chunk on language and learning skills and a chunk on problem behaviors, which, you know, as a registered nurse and a behavior analyst, it's like a lot of families really struggle with, the rigidity that can
Yes.
come up. Even with typically developing kids, you can get extremely picky eating and rigidness about food. And it's just like we don't want kids screaming at meal times.
No.
I'm sure you're not a proponent of that. I'm not a proponent of that. And there's a lot of also good tips besides these two assessments, which you can do both of them for free and
Mhm.
really look at the scores and look at the areas of weakness and see, is this a problem? Is this a bigger problem than just, dealing with it on my own? And then also chapter 10 of Turn Autism Around is a whole chapter on picky eating with things like take a 3-day diary. I know at the point where I pursued intervention for Lucas's feeding problems, he was eating, chicken and fries, but he was only eating at that point the edges of the chicken nuggets and only if they were from, certain restaurants. And it got to the point where once you looked at a 3-day diary, you could see like the calories weren't there. Keith Williams will say, he even started seeing at Hershey like kids with rickets and things that he hasn't seen in years because they're so depleted with vitamins and certain things. So I think, just giving people those kind of tools will be really, really helpful to know when and if to to move forward with getting an evaluation. So before we get too far, I do want to also talk about ARFID because
Oh, sure.
initially we were interested in talking about ARFID, which is ARFID, which stands for Avoidant Restrictive Food Intake Disorder. So
Mhm.
can you tell our listeners and me about that?
ARFID is a feeding and eating disorder that's found in the DSM-5. It involves severe restriction or avoidance of food. And it's often, just like pediatric feeding disorder, it is often mischaracterized as just being picky eating. But that's not what ARFID is. ARFID includes two domains: psychological domain, meaning that it represents a psychological disturbance, as well as nutrition, meaning that kids are presenting with either malnutrition or weight loss or reliance on supplements or enteral feeds in order to get their nutrition. ARFID is a continuum disorder. It's across the lifespan, but the two primary domains are psychological and nutrition, and that is how it differs in the diagnostic criteria from pediatric feeding disorder, but there is an overlap between these two disorders. And since there is an overlap of these disorders, that's why it's so critical that every child gets medical domain ruled out. We always must rule out medical domain, and we need to rule out the impact of feeding skills. Like, does the child have the oral motor capability of eating that food? And if not, what skills do they need to learn? Do they have swallowing dysfunction? What's the sensory interpretation or the perception of food? So it's just really important that we understand both conditions and that we understand there is overlap, which causes confusion. And we just want to make sure that kids roll out one condition or the other so that they get into the right care. That's really what's important.
Yeah. And those feeding skills, clearing food from a spoon or sucking out of a straw or moving food around your mouth that, safely without choking, without packing. Those are all really important skills. So if you have any of those problems, failure to wean from a pacifier or a bottle, then those are all medical and those are all feeding skills that can be taught systematically once we rule out, choking, swallowing problems. And it's more of a multidisciplinary team effort, I think,
Right.
at least in the
Right.
beginning.
Yeah.
So I think between your questionnaire, like I said, my Becca digital assessment, some of the things in chapter 10, and I'm sure you have lots of tools and strategies, and you have a paper that you wrote on ARFID and pediatric feeding disorders that I perused on your website. So we can link anything like that. I think it's just a good show to get the word out. And
Yes.
we don't have well, you did say pediatric feeding disorders occur in 1 in 37 kids,
Mhm.
and then
Under the age of
autism
5.
occurs in 1 in 36 kids.
Mhm.
And a lot of kids, like based on my data from the Becca digital assessment, from the 50,000 plus people that have taken that assessment, 70% report feeding issues of some sort. So it is a big problem, feeding problems. And, I started just to hear about ARFID, more recently. And I know that, getting a multidisciplinary team and getting into a children's hospital feeding program, that all sounds great, but for many families who are living around the United States, around the world that are listening, it might seem very overwhelming, but at least we're giving some people some things to start with. And I think that's what the important thing is.
Yes, and you're right, because while we may our ideas may go to some of the larger systems, the larger medical institutions or the academic programs that have the luxury of multidisciplinary care clinics that include, physicians and OTs and SLPs and psychologists and dietitians. That's really not the reality for a majority of people. Most of our kids are served at the community level. They're served in and at the community. So it's really about finding professionals in your area that you can access that feel like they're a good fit for you and your child. And we firmly believe that families are the best advocates. So it needs to be the right match for that parent and that child based on the goals of the family. We do have a very robust resource that's called the Family Guide that is free and downloadable from our website that has specific questions and directions that families can ask of their providers to help determine if they're the right fit for them and if they're the right fit for their child. I'm sure you know this through all of the work and the time that you've given your son, but you're the best lead of the team. You know your child best and should be part of those decisions.
Right. And, he has food preferences. He does tend to eat chicken and fries most days, but he also eats other things. And you know what? Like, he's happy. My sister-in-law was just saying, well, what does Lucas like to do? What really lights him up? And going out to restaurants actually really,
Fantastic.
he loves that. He would go out every single meal if we allowed it. So, you also, you need to live, you need to, experience joy, and meal times and going out to restaurants are a very joyful part of our family's lives. And, but back when he was 4, when he needed a pediatric feeding clinic, an intensive program, when he was just eating the edges of chicken nuggets and he actually had failure to thrive, like his growth for weight was not on the curve, and without that intervention, I don't know, that we would have straightened it out enough for him to really thrive. And yeah, so I think it's a great place to start. We're going to have all these resources in the show notes. So thank you so much, Kyler,
Welcome.
for all your knowledge. And it sounds like I perused the website feedingmatters.org a little bit, but it sounds like an amazing resource. So we're going to be looking at that more going forward as well. So thanks so much for joining us. And yeah, and feedingmatters.org. I'm sure if you have questions or want to reach out directly, you can do that through the site.
Yes, thank you so much.